but still remote meeting of the Burlington Board of Health. I call it to order, and it's been a year that we have been meeting remotely. I have no predictions when we'll be able to go live. I must admit, I miss seeing everyone in person and look forward to getting together at the town hall. Board member Libby Wallenjevitz will represent everyone in reciting the Pledge of Allegiance.
Thank you, Dr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, Ms. Wallenjevitz. I'm Ed Weiner, and I'm chairman of the Burlington Board of Health. And with me remotely is David McSweeney, who is vice chair of the Board of Health, and Libby Wallenjevitz, who's a Board of Health member. Tonight, Dr. Wayne Saltzman is away at a medical meeting. He may be able to join us a little late. And Mary Beth Welch, our other Board of Health member, has a family emergency, and we wish her and her family well. Also with us is Susan Luminello, who's the Director of Public Health, Christine Mathis, our environmental engineer, Sarah Kortemash, who is our Board of Health administration staff member, and Dawn Cathcart, our recording secretary. And thank you to our outstanding BCAT professionals who work so hard to make this program and many other news programs within this community possible. Thank you, BCAT. We're still operating in a declared state of emergency with special rules for public meetings. Our vice chair, Mr. McSweeney, will provide the legal requirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, and every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into the BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the phone at 408-418-9388, meeting number 129-164-1366. Again, that's telephone number 408-418-9388, meeting number 129-164-1366. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address. And as a reminder to all board members that all votes are required to be done by roll call for this virtual meeting. And with that, Mr. Chair, I'll turn it back to you.
Thank you very much, Mr. McSweeney. Again, please note that we're live on BCAT and available for comments and questions through this video technology. Everyone, remote meetings and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting. Please understand we're doing our best. And I know you'll understand if we have an issue or two, but we're all in this together, and please understand. First, we have minutes from January 12th and January 26th. Let's take January 12th first. Do I have a motion to approve those minutes?
So moved.
And second.
I have a motion by Ms. Wallenjevitz, second by David McSweeney. Any other comments? If not, all in favor? David?
Aye.
Libby?
Aye.
And I vote aye, 3-0, Dawn. Second will be January the 26th. Do I have a motion to approve?
So moved.
And second.
I have a motion by Ms. Wallenjevitz, second by David McSweeney. Are there any other comments, errors, omissions? If not, all in favor? David?
Aye.
Libby,
Aye.
and I vote aye. I just want to thank our recording secretary, Dawn Cathcart, for an excellent job in doing those minutes. They are absolutely perfect, and thank you so much. They're beautiful.
Thank you, Mr. Chairman.
You are welcome. Right now, we go to citizens' time. Is there anybody who is on this call who is not on the agenda or not on an agenda item that would like to speak to this board? Sarah, is there anybody online who has put a question?
We don't know. Mr. and Mrs. Bridges, you unmuted yourself. Did you have a question?
We just didn't have an agenda, so we weren't positive if we were on the agenda. But we got a letter about the reason we're here.
Okay, is that for one of the agenda items? Yes, thank you. Thank you, Mr. and Mrs. Bridges. I appreciate it. You will have an opportunity to speak. And if not, please just wave your arms. We look forward to it. All right. Thank you for being here. We appreciate it. Next is the chairman's report. And I promise I won't rant too much. We continue to face many never-been-seen challenges, but the Board of Health is meeting all of these challenges head-on. We're using innovative plans that we've developed well before the pandemic. We are expert. We have a medical reserve corps, but we don't think that our governor, lieutenant governor, or the Massachusetts Department of Public Health is utilizing our expertise. We've done 11 vaccine clinics, plan to do many more, maybe even a mega clinic. We've worked with the school committee, fire department, police department, DPW, and I could go on and on and on. But our state leadership has now shut us and every other municipality down when it's come to vaccination for COVID. They've even shut down our hospitals to new patients to be vaccinated. Our leadership does not communicate with us, nor does our Massachusetts Department of Public Health. We have a wonderful state representative, Ken Gordon, and an excellent and wonderful State Senator Cindy Friedman, who have advocated us at the State House to no avail. Massachusetts has a poor plan and doesn't respond to the people who have worked so hard to provide support and public health to the community. I have been, and you may have seen me on WHDH TV Channel 7. You've seen me on BCAT along with my director, Susan Luminello, and Dr. Wayne Salzman. I've been highlighted in the Herald, the Globe, the Patch, the Times Union, and others. With you, my board, our Medical Reserve Corps, our Board of Health professionals, we have done everything possible to represent this community. I and they and you have worked with our seniors, our needy, our citizens who are ill, are disenfranchised, but we are all being ignored. I'll end there, but I'll open this up, and as I usually do, to any comments that any of our staff or our board members or even people watching this program would like to make comment. If not, I'll just move on. We're at subcommittee reports. Now, we had a subcommittee yesterday, Mr. McSweeney. Shall we hold on to that until the proposals brought to us at our next meeting? Your call.
Yeah, I think it's probably wise, and only because you know, I don't think we fully approved it yet, so it'd be good to wait until they get the minor changes that they committed to done before we talk about it in the subcommittee.
Very good. Our next order of business is permits. And the permit we have is 8 DeVita Road, keeping of chickens permit application. I'll ask my Director of Public Health, who is going to present that? Susan?
Yes, I can present it. So Ms. Zhang is here for a permit to keep 4 chickens. Samantha Hardy, our Associate Health Inspector, was out on the site, viewed where she plans on keeping the chicken coop. There's pictures included in your packet. The current coop that she has now is room enough for 3 chickens, and her plan is to use the, it's like a small shed type add-on to the coop to make more room for the 4th chicken. She'll be adding bedding and a roost area into that shed area for the 4th chicken. Her manure plans and all of her other required plans are part of the packet that you received. She meets all the required setbacks, and Samantha Hardy, our Associate Health Inspector, recommends to grant this permit.
Ms. Zhang, would you like to say anything?
Yeah, I just want to mention that it's just I really like chickens when I was very young. So really, I want to keep them mostly for pets, and I will only get hens, so there will be no roosters anyway. So, and also I will treat them well. And I have friends who own like maybe 100 chickens, so I can get any help, or if I have any questions, I can always ask them. So I would also try my best to keep them quiet and clean. And I also do gardening a lot. So yeah, I think I'll manage the manure well to compose them for the gardening. I think that's all. If anyone have questions, you can ask me and say.
Mr. Chair, if I can ask just a couple of small questions.
Please.
Yeah, so Ms. Zhang, thank you for that. I appreciate it. You've never raised chickens before?
I did before when I was
Oh, okay.
young.
Oh, okay. And also, I got Susan. She has a copy of the recommended procedures from the state that we've been following, the guidelines, or she will get one.
Yes.
Okay. And Ms. Zhang, you understand what you need to do there as it relates to the keeping and caring of them?
Yes, I checked the Burlington Board of Health website. Samantha also mentioned that to me, so I have all the information.
Awesome. Okay, great. Thanks, Mr. Chairman. I have no other questions.
Okay. Ms. Wallen-Jevitz, do you have any questions? You're on mute.
I'm fine.
Okay, thank you. Well, I don't want to go afoul here. Do we have any abutters who would like to speak? Are the Bridges here for that?
Yes, we are, I think.
Yes.
Am I on?
Yes.
I think you're back on mute again, Mr. and
Mr.
Mrs.
Bridges, you're back
Yeah.
on mute. Yeah, we have, I see you in the right-hand corner here.
I know.
Second.
I've never used WebEx before.
No, that's okay.
So, so I am in a butter, live at 6 DeVita Road and next to the property, and we have lived here since 1997. I just have a written statement that I had talked to a friend of mine who had raised chickens. When I received the mail, I called my friend Terry Wilkinson, who lives at 90 Dale Street in Abington, Mass. She stated to me that originally I thought it was a good idea to have egg-laying chickens for fresh eggs, but immediately became a problem as my chickens would fly out of the coop to sit on the fence and get around the neighborhood, which I had to retrieve almost every day. The worst was they would fly to my in-ground pool. Chickens mostly cannot swim, and it led to a drowning of a number of the chickens. On top of this, predators would routinely come by instinct to the smell of the chicken coop. These predators included hawks, coyotes, foxes, and raccoons, which would visit on a routine basis. The worst was the raccoons. Once they got into the habit, they would lay on top of the coop. I could not wait to get rid of the chickens. We have a pool, and this is similar to the Abington type facility here, not facility, but property here. I'm not sure. I don't know much about chickens, but we do have a concern of possibly E. coli, salmonella, campylobacteriosis, and avian flu, possibly from transmission from the chickens and maybe through the manure too. So just have some concerns here, and maybe we can address these concerns at the meeting, or I don't know how we would deal with this. And that's it for now, I think.
Well, Mr. Bridges,
Yeah.
I'll ask our director address those, but we have many, 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 many chickens in Burlington. I know you're aware of that.
Yeah,
And yeah, it is. And we're very, very clear that if it's a problem, and I want to say this right up front, we'll shut it down immediately. Okay? We don't have much patience for problems like this. And I'll ask my director to address them, but I got to tell you, we haven't had that problem. But if you in Burlington, because maybe it's because we have so much oversight, but and we only are allowing a few chickens here. So I before we vote, I just wanted you to be a little aware, and I have to speak. Ms. Sullivan would like to speak too, but I just want you to be aware that we have so many permits. It is you called it a fad. Well, it is the fad. And we have not had these problems because her property is well fenced. And if you have a problem with any types of animals or your pool, it'll go away quick. We'll make it go away quick. So I just want to assure you that if we decide tonight to give her a chance, you just have to keep an eye. All right?
Yeah, Mr. Chairman, can I just add to that? And I totally appreciate your point of view, Mr. Bridges, on this, and would love to hear from the other abutter as well, because we're certainly, this is not a rubber stamp, and would want to hear any concerns that you have. But to kind of echo what Ed was saying, we have, I don't even know the number, but I would say 100 households in Burlington that have chickens, and we have not heard complaints. And if we do approve this evening, it does get it's an annual approval, right? So they would have to get it reapproved, and it will get reinspected. And if there are any issues or concerns that arise, as Ed was saying, Mr. Chairman was saying, that we wouldn't reapprove the permit at that time. It is an annual approval, not a lifetime approval, and it is for only 4 chickens. So.
Right.
So if there's a fifth one that comes on the property or a sixth one, we can certainly address that as we find out about it as well.
Well, thank you. That's great.
But thank you, Mr. Bridges, thank you for, and please look out. I mean, first of all, if there's any issues, you call the Board of Health right away. And if it's not, I'm in the book. Everybody calls me, and I'd love to hear. First, can we also, Susan, before you, we have Ms. Sullivan. Would you please take yourself off mute? I know it's not easy here. We're doing the best we can.
No, thank you. I appreciate you allowing us to be part of this. Part of the reason why I'm here is because I'm not familiar with chickens, and I just figured I would come and become more informed. We did have a few concerns. I'm 10 DeVita Road, so I'm on the other side of the 8 DeVita. And I guess one of the concerns was like if there was going to be a smell or if it was going to attract rodents. I think the first thing I did when I got the letter was go online and just to see pros and cons of chickens. So I guess like the smell, the cleanliness, attracting rodents, noise, those were all concerns that I had. And I think I'm just concerned with the warmer weather coming, and we use our yard a lot. We have children, grandchildren. We have an above ground pool. So those were all my concerns. Again, I don't know how noisy chickens are, and I know it's only 4 chickens. But I just figured I wanted to be part of the meeting just to become more informed. And I believe someone on the Board of Health also said Burlington has a rule against roosters. Is that?
Yes.
Okay, so, and I know when he had said that she was only doing chickens and not roosters, or
Right.
so.
Yeah, and sorry, I just want to mention that I'm planning to get those chickens, which they call it sex link, which they can tell if it's a rooster when it just maybe a few days old. So so those stores, they only sell hens, they don't sell roosters.
Oh, okay.
Yeah,
Yeah,
if
we
by
don't
any
allow roosters.
chance, if by any chance there's an incident, we got a rooster, I can always give it to my friend. I have many friends around the Boston area. They have many chickens. They can keep in those towns. They can keep roosters. Yeah, in some of the towns, you know. Mhm.
I had a quick question too. I know Tim had mentioned about them flying out. Like, there's no cover on where the chickens are kept. Is that? I'm
No,
not sure.
I bought actually I talked with Samantha as what she suggested. I bought a chicken coop which include a chicken run, and the chicken run is a kind of enclosed chicken, so they will not be able to fly out. So they will be always in the chicken run. Mhm.
And that is part of our regulation. They can't be free roaming chickens. They have to be
Right.
in a coop.
Yes. Mhm.
Okay. Well, thank you for allowing us to be part of this too.
No. Please join us anytime. Susan, our Director of Public Health, Susan Luminello, would like to address us.
Yeah, that's what I wanted to ask Ms. Zhang. I wanted to make sure that she did have some type of room and that chickens were contained somehow. So
Yeah.
you are confirming that, because and you also need to understand too that they cannot leave your property. It's what we've heard from other people too, is that the more you can contain it, the better it is for you and the chickens as well, because it does prevent things like hawks and things like that getting the chickens, because people lose a lot of chickens, you know, in that way if they let them roam on their own. So it's better off if you don't do that anyways.
Yeah, I appreciate your advice. Yeah, I heard a lot of different stories from my friends, you know. So yeah, I think I'll try to prevent those.
Anybody else have any comments? It has been, since we have so many permits in this town, it's been we'd like to give some people a chance. But understand, Ms. Zhang, that if there's smell, if there's a problem, the chicken's getting away, if there are any issues with noise, we'll have to discontinue. Not only we represent not only you, but we represent the whole community, and that means the Sullivans as well as the Bridges, and we'd like to give people a chance. And what we've seen in the past is it's worked out okay. It's really worked out okay. But there are times that it may not work out okay. So please understand that you have neighbors, abutters, who are kind of leery. So you're going to have to be really on top of this if we approve this plan for just 4 chickens.
Yeah. Yeah.
Go ahead, Michelle. Say something.
Sure, Ms. Michelle Bridges, please.
Yes, that's me. So I just have a question. I don't know if you guys can answer it or not, but the gardening area where the manure from the chickens will help the garden to grow beautifully is right beside our in-ground pool. How smelly is this? Like, does anyone have any experience with this?
Susan, you've had experience.
We have many people who use it in their garden, and I've gone out on many inspections for chicken coops, and there hasn't been any smells from the manure. So
Oh, good to know.
yeah. So I
It's not, yeah, it's not like cow manure.
problem. Yeah.
Yeah, it's not like cow manure at all. It's not.
Oh, that's just because it's right beside our in-ground pool. And I'm known to be floating around since I'm a teacher. I'm out there a lot in the summer, so thank you.
Again, if there is, make sure you give us a call at the Board of Health, and we will investigate if there's any issues.
Thank you
Look-
so much, and thanks for the opportunity.
Well, thank you. The history that we have had with this, and we have had a lot of twists and turns, and making sure that neighbors stay good neighbors and abutters stay good abutters, and we have not laid many eggs here with making mistakes and granting small permits, but it is what it is, and usually we're going to ask you to please keep an eye. Both Miss Sullivan and Mr. and Mrs. Bridges, please keep an eye. I'm sure that your neighbor Miss Zhang is under. She knows now exactly what needs to be done, and she has to be absolutely vigilant in making sure that this works for everybody. So I'll leave it at that right now.
Mr. Chairman, with that, I'd like to make a motion to approve the permit for keeping of chickens at 8 DeVita Road.
Second.
I have a motion and a second. Are there any other discussion? My other discussion is that we're watching, and your neighbors are too. So
We need to be vigilant, and this is a good thing for the town that we allow it. But it's also, we got to make sure that the neighbors are all happy, and not everybody likes it, and everybody needs to accept that.
So, but I ask you, call me at home, call the Board of Health, call whatever, but we want to make sure. We usually give people a chance. It's only 4 chickens, okay? It's only 4 chickens, and we'll see how that works. I have a motion and a second. All in favor, Mr. McSweeney,
Aye.
Ms. Wallen-Jevitz,
Aye.
and I vote aye, 3-0. But Ms. Zhang, please be vigilant, okay? We want you to keep relationships with your, and I gotta tell you, what we've seen over and over again is your grandchildren will want to see the chickens. You wait and see.
Yeah, actually, I really like Burlington Town, and also I really like my neighbors like Michelle and Tim, and also my other neighbor on the 6th DeVita Road. It's Mary and also Lester. Yeah, I really like our community, so I'll definitely do my best. Yeah, I really appreciate everyone.
And Ms. Zhang, they're not giving you a hard time. They're not. What they're doing is they're opening up some communication with you, and they are just voicing some concerns right up front to help you.
I fully understand.
To help you be successful. All right. But I urge.
Yes. Yeah, and actually, yeah, Tim and I, we talk a lot about the gardening. Actually, we are good neighbors. Yeah.
Okay, I can see that.
Yep.
Yeah.
Thank you all. First of all, I'm going to call you by first names, Warren, Michelle, and Mary. I want to thank you for getting on. I want you to thank you for being good neighbors and getting on. And please join us anytime. And if you have any concerns, please call us. We can be pretty draconian. Thank you so much.
Yeah. Thank you.
Thank you.
Thank you, everyone. Have a good night.
Okay.
Thank you.
You're welcome to stay.
Thank you.
Thank you.
Bye.
Staff reports. Environmental engineer. We have an environmental engineer's report. Would you like to say anything, Christine?
Sure, just a couple of things I can update you on. I'm in the process of doing the renewal of the biological safety permits for the companies in town that currently have them. None of them changed any protocols or added any new strains or procedures. So they were all pretty straightforward renewals. We did the hazardous materials registration mailing. Thanks to Sarah for her help on that. And that went out to about 110 or 15 companies that store hazardous materials and or generate hazardous waste. Those are due back March 15th, so we're getting a flooding of returns. And I have been doing some planning for an April COVID compliant HHW event to be similar to the one we conducted in September. So, and then those are the normal environmental engineering things I do in addition to some other stuff, but then also, you can see from my report, a bunch of COVID related tasks, including following up with employers that reported positive employees, as well as investigation of complaints, COVID related complaints. So with that, I'll take any questions you might have.
David, you have any?
I don't, Mr. Chair. I'm all set.
Libby? We can't hear you, but yes, you're nodding no.
I don't have any.
Okay, I have one, Christine.
Sure.
Would you please relate the what you told me about the two groups that need permits, one as soon as possible for biological permits?
Yeah, we've got two entities that are seeking biological safety permits from the board, one of which is AMRI on 99 South Bedford Street. They were, they're still working on their application materials, so I haven't seen their application materials yet, so I think that it's not quite as urgent as when they first approached me. I'll keep you posted on that. And the other one is Northeastern University. They're both going to be doing COVID-related work. And because the COVID vaccines are synthetic nucleic molecules, they are covered by our biosafety regs.
Thank you.
Sure.
And these, Christine, these are outside, well, I'm assuming Northeastern is, but the other one is already in town, so this is outside of Azure. This is not part of that.
That is correct. Yeah. I don't know how long AMRI has been here, but I've been inspecting them annually as part of the hazardous materials program. And before me, Susan was inspecting them. So they've been in that program for quite a while. It's just the addition of a production of a COVID vaccine and production of a treatment for cystic fibrosis that are new to their process. So that brings them into the biological safety regulations.
Yeah.
I have a question, Christine. Is Northeastern a permit for something else? Do they currently hold a biohazard permit?
They do not currently have one there. So if you'll recall, they have 3 buildings over on that campus, or main buildings. One is the old Elliott Hall, and they had some laboratories in there. They have the Costas Research Institute, and that has a number of tenants that do a variety of things. And I have been inspecting both of those in the past under the hazardous materials program. And they now have a new building, brand new building, which is, I think it's in on the south end of that, southwest end of that campus. And in that building, they're adding a couple COVID labs that fall under our biological safety permit.
Okay, thanks.
Thanks. If there are no other questions, do I have a motion to accept the environmental engineer's report?
So moved.
Second.
So I have a motion by Libby Wallen-Jevitz, second by David McSweeney. All in favor? David?
Aye.
Libby?
Aye.
And I vote aye. So that's 3-0. Thank you so much. Now, the next one's a little complicated. The next is the Director of Public Health, which will include taking in order the health agents' reports from February the 9th, and the next one is February the 23rd. Then she has two reports, one on the 9th, dated the 9th, and one dated today. Then we have second, a health inspector, the associate health inspector is February the 11th. And then we have the supervisory nurse, which is January the 15th and February the 1st. So to that end, let's take them all three, and then we'll speak to Susan Luminello, and then we'll vote on them as one agenda because the other three people are not here. Would that be okay, Susan? I think that's well within our purview to do it as just one vote, unless we have to do three. What do you think?
I think that's fine.
Okay. So first is the health agent's report. Do we have any questions about Marlene Johnson's report?
So, Mr. Chairman, I think this was Marlene's report, and I forget because I was reading through it, but there was a thing, Susan, in there on the igloos. I'm assuming it's the one for Tavern in the Square. Was that the same in relations to my phone call, or is that a different investigation? I think there was I saw the igloos in there on her report.
I'd have to take a look and see what she put in there specifically about the igloos. I don't think it was. Let me just take a quick look. I think it was related to what the question that you had asked, because I think we just had kind of answered that. And
could you just fill in everybody what the igloos issue is?
So David just had a question for me about the igloos, and we do have one food service establishment that has them, and his question was, did we have any issues with them, and are they regulated? And as far as we are concerned, there is no issues with them. The building department did have to take a look at them to make sure that they were, okay according to their standards prior to approval. It was part of the task force review of COVID and looking at those igloos. So we, at the time, we had no issues with them. Marlene is part of that task force, and as well as the building department and several other departments. So I'm looking at Marlene's report now. I don't see.
I saw it on a report. I thought it was her report. Unless you put it, did you put it in your report?
I don't. It's possible. I don't.
So, and I'll go back and look in a second. But Ed, Mr. Chairman, just to give you some context, so I did receive a call from a resident, and it wasn't really a concern, but just they wanted to kind of talk through how the igloos, and I think there's 4 of them at Tavern in the Square, and I believe that's the only establishment in town that has them. They were just concerned about if we're monitoring for such as, are they properly ventilated, and how are they sanitized, and what's, do we have any data or concern around COVID staying inside the igloos after a party leaves, and do they stick to the walls of the igloo, and so forth and so on. So it was more in relations to COVID than it was overall. But when I called Susan, I was just talking about the igloos in general and about the sanitation, and if we have any areas of concern, or are we involved, and we kind of talked it through a little bit.
How large are these igloos?
I'd say they're 10 by 10-ish or something like that. Yeah, they're round. They look like an igloo, but
Yeah. And
I think there's only one table. There's only one party at a time in there.
Right. Only one party at a time in one igloo.
Okay. Okay. I'm not in, I have never eaten in an igloo.
And I probably never will. But some people enjoy them in the cold months to sit out there, I guess. But I guess the resident was asking, are they appropriate? They have to be heated, of course, I'm assuming. So are they appropriately ventilated? Is there HEPA filters for COVID stuff that comes in there? And then in general, how are they sanitize, and if we have any purview over that at all?
Yeah, so that the heating aspect of it falls under the building department. And as far as COVID goes, that goes to like indoor air for, I think this is what David and I talked about, indoor air for anywhere. As far as we just don't have enough information to know how many exchangers we need exactly in that type of environment. So we haven't had any issues with them or anything like that, but.
Well, thank you, so whoever did that, bringing that forward. I'll have to go down there and see them.
You can actually see them right from the Mall Road. They're on the Mall Road side. I think there's 3 or 4 of them that are there.
Okay, thank you so much. Okay, so that is Marlene Johnson's, who is our health agent sanitarians report. Okay, the second will be the health inspector. The health inspector, Samantha Hardy's report. Does anybody have anything that they would like to bring up? All I can say is one thing, and both for Marlene and both for Samantha, I've been in the office a number of times during our vaccine clinics and seen what they're doing, and everybody's working together, doing everything they possibly do to keep Burlington safe and healthy. So that's all I can say. There's no questions. The next is the supervisory nurse, Christine Pollock. Are there any questions or comments? Libby, do you have any? No. David? No, I just have a comment. And for anybody watching this, under our supervisory nurse's report, under communicable diseases and surveillance, yes, we still have diseases that we have to keep an eye on that go on in this community. We have a very diverse community with people who have come from all over the world and lived here from all over the world, from people who have traveled here and continue to travel. And just because we have COVID does not mean that we don't have very serious communicable diseases that need surveillance. And Christine is taking care of that and doing it well. Thank you.
Dr. Chairman, I take back my statement. I'm not sure whether it belongs here or with Susan, but I was just curious about the convenient MD and the dispensing of vaccines.
It went very well. Susan?
Yeah, I was going to say the same thing. So yeah, it went very well. We were able to do, it was very smooth. There were no issues. Convenient MD was great, and we were very thankful that they were there to do that for us.
Is it a one-off or will it happen again?
Well, they're going to come back to do second doses in 28 days.
Oh, but there'll be no new appointments or anything. Okay. All right. I just wondered how it fit into.
They're not getting any more vaccine either. So,
right.
Yeah.
I just wondered how it fit into all of that. Okay. Thank you very much.
Libby, just to assure you, I was there at the beginning. I addressed Susan and I and Christine addressed them all. I spoke to them all on our behalf. I thanked them. I met them all. I thanked them. And I noted to the press when they called me about that Convenient MD, we're good. We're trying to be good new neighbors in our community. And I, again, on BCAT, I want to thank them again.
I feel the same way. Was it at their new facility, or did we do it at the Kelly Murray Wing?
We did it at the Kelly Murray Wing. And
Okay.
strange enough, you know, I do complain about the Massachusetts Department of Public Health, and I've been very consistent because Susan knows, because I have been complaining about them for, this will be coming up my 33rd year of complaining about them. But they were also complaining about the Massachusetts Department of Public Health because they can't open because it's been a very long time and they haven't received their license to open. So maybe that was a
That's
good thing.
incredible.
Because we were able to they were able to help us because they can't get their license, and they were very vocal about that. Okay. Susan, do you want me to tell people how I really think? Brings us to the last. Last is the Director of Public Health report. Lots here. I have a major question that Susan knows I'm going to ask, but does anybody have anything that's out here for the?
Mr. Chairman, just one question, and not necessarily, well, it was based off something on the report, but do we have a general, Susan, a general understanding, and maybe we at some point in time we can have him come back in front of the board again, on how the schools are doing, and are you still in contact with Mr. Larkin, Dr. Conti, and how's everything going over there?
Yeah, so yeah, I talk to them still on a regular basis every week. Last week it was school vacation week, so it was a pretty quiet week. But the number of cases are going down in the community, so we're also seeing that in our schools as well. You know, I've seen the school quarantine list go down pretty significantly, so we don't have too many school-age children who are out on quarantine, which is great, and it kind of mirrors what's happening in the community as well. So I think that their concern right now, and it's current concern with the whole state, is when are they going to be able to get their staff, the teachers, vaccinated? So that's the big thing. And you know, we did want to help out with that. Unfortunately, you know, if we don't get the vaccine, we're not going to be able to do that. But I think that that's really, you know, their concern right now. But like I said, the numbers are going down, so that's good.
That's great, thank you. Nothing else for me, Mr. Chairman. Okay.
I also want to point out too, in my report is the annual report, which is completed. Most of the stuff on that is COVID related because that's what we have been doing for the last year. And what's pretty much the annual report, I put in what's different, what's new, and that's really what's been different this year.
Libby, do you have anything? Okay, no. Well, I have two things. First, tomorrow afternoon, Mr. Hosford, Mr. Rich Hosford from BCAT will be interviewing Susan and I again as part 2 of our vaccine situation in town. I want to invite either David or Libby, if you would like to join us. In the past, Wayne has joined us, Dr. Wayne Salzman, but since there are going to be no real clinical discussions, he felt it wasn't necessary for him to be part of that. Susan and I have committed. If either of you would like to get on and make comment, please just let me know, and I'll make sure that you're both invited. Either or both of you are invited. Now, the one question that was posed to me, and it is an interesting discussion, is a proposal that came to Susan yesterday from a couple of communities who are not far from us. And the decision that she, myself, and Mr. Sagarino, apparently you spoke to him, had discussed. And please, Susan, just let the board and the public know what's happening.
Okay, so it also part of our board materials, I included a letter from the state, Mary Lou Sutter's, that we received, all boards of health received last week regarding sending vaccinations to local boards of health and how the state was going to stop doing that. And if you, in that letter, it talks about an opportunity for local boards of health, if they so choose, to have a regional collaboration where they would collaborate with different cities and towns around them. And it has to be in an area where there are no or not many mass vaccination sites. The area has to be approved by Department of Public Health. They put many stipulations on the requirements of having a regional collaboration. One of the stipulations is that you have to run 5 days a week and you have to give out 750 vaccines a day. Another one is that you have to open it up on the state's website, just like all of the other mass vaccination sites are. So Bedford, a couple of days ago, reached out. Well, actually, that was Friday. Last Friday, reached out to Burlington as well as other communities: Carlisle, Concord, Wayland, Westford. There's a couple others there. And we had a discussion about regional collaboration because they wanted to do regional, some type of regional collaboration, although what that looked like wasn't exactly hashed out yet. So they wanted to know if we wanted to be a part of that. I met with them last week just to hear, what their thoughts were, what they wanted to do. And I spoke to Paul today about it. The big issue that I have with it is that we have to put it on the state's website and it has to be open up to the entire state. So I really don't see the benefit to the residents of Burlington for that. If we're going to put our time and resources into running a vaccination site and then not be able to prioritize at least some of our residents, I just don't see what the benefit to that for us would be, because really basically all we would be doing would be running another mass vaccination site. So my recommendation to the chairman, and I talked to Paul about this as well, and Paul is in agreement as well, is that unless the Department of Public Health changes their terms or conditions, I don't think it's worthwhile for us to run one of these sites at this time. And also too, Paul went on a call yesterday with the town administrators and the leaders in these other communities. And on their call, one of the things that he thought he understood from it was that you have to have a set site. So it couldn't go from Burlington to Acton to Carlisle. It would have to be in one central location. So again, I don't know if that would be any benefit for our residents, depending on where it is. Some of these communities are not really close to Boston, for example, to Burlington, like Concord. I don't know if our residents would be interested in going there. I think what I'm hearing from our residents is they want to come here to Burlington. They want to go to our senior center or our high school or someplace in Burlington, and for Burlington residents. So that's what my recommendation is on that. And I wanted to explain it to the board tonight, see if you had any other comments about it or any other thoughts.
Yeah, Mr. Chairman, if
Please.
I may. Yeah, and Susan, thanks for that detailed overview. Much appreciated. And I am 150% supportive of your recommendation and decision around that, as well as Dr. Weiner's. I think, as you know, because we went through it, right? And one of the reasons why we're adding another staff member, we're underwater. And if we're going to commit time and resources to something that the residents of Burlington ultimately can't get 100% supported by, it doesn't make sense at this time. Maybe down the road we can revisit it if that's the only solution that we have. I still think that we have some time to figure it out, and I still think the state may, and this is just a personal opinion, I don't have any inside information, may change their philosophy on reaching out to the citizens on how best to vaccinate them. So while I am 150% in support of that, you're absolutely right. Burlington residents want to go where their comfortable and where they know the folks, where they know where they're going, and they have confidence in the leadership of the Board of Health, in the staff, that that's where they're wanting to go. And they won't go to, even I would doubt they would even go to a Reading or Wakefield even, right? But I'll caveat that again. I would think, let's not be so close-minded on it that down the road, if that's all the state's going to do for us, we may have to revisit that. But at that point in time, we can talk about it. But I'm 100% in support.
Dr. Chairman?
Sure, please.
I agree with what all of what David said. I think I support you 150%, 200%, whatever, in the decision that you made. I am becoming more and more concerned about it moving to all of these big places, and I feel like the elderly and people that can't get around very well are being squeezed out of getting vaccines, and they're a pretty needy population. I mean, I can't imagine someone with a walker at Gillette Stadium. And that's just, where my thinking is right now. And I certainly want to leave it open in the future should it become a little bit more decentralized. We practice that. We can do it, and we can do it really well. And we're being denied the opportunity. Done.
I can tell you that Susan and I had a very long talk about this because I wanted to make sure that we were fully understood what the situation is. I don't see the utility of setting up a mega site in Burlington where Burlington residents may not be able to even get in. Any of them get in. It's not what we're trying to do. We're trying to have local vaccination centers. And when we do everybody in Burlington, yes, we'll open it up. But first, those our seniors, our needy, those of our seniors and those of our community who have diseases, who are very ill, should be able to come to a local center. We've done it. We have drilled it. We have 300 people in our medical reserve corps. We have done everything I can do, and you have done to express that to our governor, lieutenant governor. And if you have been following, I'm probably not very well liked around Beacon Hill these days because I'm calling it out. I'm calling it the way I see it, and it is what it is. It's very, very, very difficult. My wife and I have tried to get her an appointment now for days and days and days. The system doesn't work. The governor can't get it fixed. The lieutenant governor can't get it fixed. Today I called 211 because they said you could get an appointment by calling 211. So I had to test it. So I did. And I said to the person, have you been able to get anybody an appointment today? Even one person? And they couldn't answer that question. So the system is broke. We have a solution. It just astounds me that they are not interested in helping us fix an egregious situation. So I'm frustrated, and I know you are too. Everybody on this call is too. With that, I have nothing. I have to ask for a motion to approve the Director of Public Health report.
So moved.
I have a motion by.
Second.
I have a motion by. I was going to say. I have a motion by David McSweeney, second by Libby Wallen-Jevitz. All in favor? David.
Aye.
Libby.
Aye.
And I vote aye, 3-0. That's all we have tonight. Is there anybody else who'd like to say anything tonight or anything in closing? David?
No, I think you've done a good job, Mr. Chairman, of framing it out. I don't have anything to add. Thank you.
Sure. Libby?
Nothing to add.
Thank you very much. Susan? Sarah, you have been our front line. If you have anything to add.
No, just keep everyone safe and well.
Christine Mathis? Anything to add?
No, nothing to add.
Our BCAT professionals, do you have anything? No. And Dawn Cathcart, thank you for everything that you do. Your notes, your reports, your minutes are beautiful. Thank you all. With that, do I have a motion to adjourn?
So moved.
Second.
A motion to adjourn. David,
Aye.
Libby,
Aye.
I vote aye. Good night, everybody. 3-0. Good night, everybody. Thank you.
Good night.